Hey everybody, Dr. Justin at Fulk Chiropractic. I'm going to continue on day 2 of my low back pain series for the week. Today I'm going to talk about Facet Syndrome. The facet joints, chiropractors talk about facet joints all the time. The facet joints are the 2 joints in the spine all the way up. So you got 2 facet joints at every level, and then you've got the disc on the front side. So that's what connects one segment to the other. So the facet joints are what we adjust. When we do an adjustment, we got a popping. We're separating the joint space here and of the facet joint, the gas pressure released from that joint space, and it has a feel-good effect. So that's what we're talking about today. It's a very, very common condition. Again, I talked yesterday, general low back pain is the most common condition, or one of the most common conditions for a visit to the doctor's office of any kind. Facet syndrome is probably one of the more common ones that we see overall. So with the facet syndrome, I just got a little chart here. So what we're looking at is the facet joints here in the lower back. So typically goes to one side, can be both sides, can be worse on one but not as bad on the other. And then typically will radiate pain into the buttock and down the back of the thigh to about the knee, typically no farther than the knee. Most patients that come in with something like this say, oh yeah, I've got sciatica. That's a whole different condition. I'll cover that again later on. But facet syndrome, radiating pain, comes down the back of the thigh to about the knee. Very, very common. So this is typically going to be worse when you sit for a while, especially if you sit for a while and then you go to stand up and you can't straighten all the way up and you feel like you kind of got a catch in your lower back. Also gets worse with twisting and like vacuuming, any rotational or repetitive movement, and hyperextension. Anytime you go to lean back, because you compress those facet joints and it gets that sharp stabbing pain in your back and wants to drop you down to your knees. Typically gets better with laying down. But not for too long, because then it gets sore again because you're not moving. And it's better with light activity, just getting up, walking around, moving around, but you do too much and it gets worse again. And then constantly changing positions. If you find yourself, your back is sore, and if you move around a little bit, it's a little bit better, but then you have to move around again and again and again. Those are pretty good indications of Facet syndrome. Treatment options here in our office, similar to what I said yesterday. Chiropractic adjustments, number 1. You adjust those facet joints, you get that function back, the pain will start to go away. We also utilize things like cold laser therapy, acupuncture. Spinal decompression is great because it tractions those facet joints and the discs, and rehab exercises for stretching and strengthening the area. Expectations of care with something like this, real similar to the uncomplicated low back pain. Typically, if I see somebody 3 times a week for 2 weeks, I'm in that 50 to 60 to 70% range of improvement, feeling pretty good a lot of the time. Maybe a little flare up here and there, but for the most part, feeling pretty good. So that's pretty much what we're talking about with the Facet syndrome. Again, chiropractors treat this all the time. Very, very effective care. Tomorrow, day 3, we'll be talking about a lumbar or low back sprain and strain. Until then, this is Dr. Justin. Stay healthy.